What does State of Global Air Report 2025 shows that should have our prime attention? What has been highlighted as the second biggest killer across the world? And why the epicenter of that killer is in India. The process of breathing, which is responsible for lives in human beings, has become as deadly as it gets. The recent State of Global Air Report has clearly highlighted that air pollution is the second biggest cause of premature deaths after hypertension. This is an alarming situation calling for attention and also reform. Hello everyone, welcome to Vajiram and Ravi's Flash News. My name is Shubhangi Singh and today we are going to understand this report which is highlighting a crisis which is in front of us, which is created by us humans, and it is concentrated in our very own country where India is the epicenter of the air pollution related premature deaths. So let us try to understand that what are the key findings of this report from the very start. So if we talk about this report, the figure that has been brought in front of us is the highest, that is 8 million premature deaths every year are taking place. Now when we are talking about this report, it also has shown that air pollution is the second leading cause of early death worldwide. And another thing that has been highlighted is the fact that India and China alone comprise of 54% of this number. When you're talking about children, that too under 5, they are the worst affected in this scenario, and India is leading with the number of 169,000. So this paints a painful situation in front of us, but we cannot say we did not know this because this has been created by humans. Two main culprits which have been identified are the household air pollution and the vehicular emissions, which clearly point it towards us. To understand the depth of this situation, you have to realize that this is not an environmental concern anymore, rather it has become a public health emergency. And this emergency is very much concentrated in low and middle income countries. For example, let us look at the data which has been put forth in this very report. If you see the global average which has been highlighted here, and if you look at the number for South Asia, especially when we are talking about exposure in terms of particulate matter 2.5, South Asia is at the double point, and it has been at the double point for the longest time. So it is not just about particulate matter, it is also about ozone exposure, which is responsible for air pollution related deaths. Again, South Asia remains way higher as compared to the global average that we get to see. So it is clearly showing that yes, a crisis is at hand, but we have to worry about this more because this crisis and its epicenter is in our country. To explain this better, let me show you a few more figures and data. So starting with the first one, that if we talk about deaths, premature deaths related to pollution, India unfortunately holds the first position here. Apart from that, we also get to see that India stands first when we are talking about child deaths due to pollution, and the number is crossing more than 170,000. This number also shows that 2.1 million premature deaths which happen in India are a combination of outdoor exposure and also household air pollution. So it's not that you're exposed just outside your house, you are exposed to this air pollution in the very place which should be your safe haven. And what brings us the stark reality is the situation of the capital of our country. If you talk about the particulate matter levels in our country's capital, that is Delhi NCR region, they are more than 8 to 10 times higher as per the limits which have been prescribed by WHO. And last, just to paint this picture, 1 in every 5 deaths that occur in India, one of them is related to air pollution. We get to see the amplification of impact of air pollution in our country, where we are bearing the dual burden of outdoor as well as indoor air pollution. We do have multiple schemes, be it Ujjwala Yojana, bringing in LPG cylinders instead of the gas or coal that was used. We have FAME, which talks about electrification of public transport, and many others. But again, it highlights one important thing, that policy is at one place, implementation remains way away from that. And the situation is not just this in India. If we talk about the global numbers, it clearly highlights the fact that Europe and North America, basically the global north, gets to develop and also focus on this public health emergency, where the numbers are not as bad because they have stricter standards, there is clean energy transition already in place. But when we talk about Asia and Africa, they have the highest mortality burden also, and lies the burden of economic growth as well on them. So basically we get to see global inequality in mortality burden as well, where these developing portions of the globe, where they are aiming to bring in more urbanization, industrialization and better energy, this is also directly hitting them hard in form of mortality. We also get to see that air pollution is not the only cause, it is fueling the other causes of deaths such as heart diseases, stroke, diabetes as well as lung cancer across the globe. Enough with the data where I have shown that it is an emergency situation and it needs to be addressed well in time so that we can actually be saved and we can save the world as well. So the situation at our hand clearly calls for not just for global coordination, but technology sharing and real holding on to commitments when the countries need to come together on platform and actually work in real time to solve this particular problem. Now let us understand and further break down this particular topic. Let us understand that what are the major causes of air pollution that we get to see. So there are two sources, outdoor sources and then we have indoor sources. When we are talking about outdoor sources, we have vehicular emissions, which is coming from diesel and petrol combustion that takes place. There is industrial pollution. Then we have construction dust and agricultural stubble burning, which can be easily understood when we are looking at the case study of Delhi NCR, where all of these factors are responsible for the air pollution that this region gets to see every year, especially heightened during winters. But this is not it, because there are indoor sources as well. There are households, especially poverty-stricken region, where biomass is used, coal is used, wood, especially for cooking. There are regions there, houses where there is no proper ventilation, and there is also burning of incense, which takes place on almost every household. Then we have mosquito coils, and then we also have mosquito sprays and whatnot. All these are nothing but air pollution sources which need to be identified, rectified and put in place. So when we are talking about air pollution as a problem, it is not just an issue of policy, it is an issue of science also, it is issue of awareness also, and yes, definitely policy as well. So let us understand, this basically brings us to a very simple point, that outdoor sources are contributing, but at the same time indoor sources are equally responsible for it and they need to be addressed accordingly. Now let us move on to understand that why this is being called a crisis situation. If the number of lives which are being lost are not a factor, then let us understand in terms of economic and social factors which further exacerbate this particular given problem. When we are talking about economic terms, we get to see that there is loss of 1.5% of almost GDP in terms of GDP just for our country. So there is economic loss also involved. Furthermore, there is added healthcare burden because air pollution is leading to chronic respiratory as well as cardiovascular diseases. So India is going to be earning less and it is going to be spending more because of air pollution. Furthermore, the productivity that comes with the labor, as well as when you are talking about human resources being developed, human resource development that happens in school, colleges, all of this is affected in a negative way. And it is clearly seen that the effect is more on the poor, children as well as elderly. So there is an economic effect, yes, where there is more expenditure, lesser productivity, lesser GDP, but the pollution is also deepening the inequality, where the poor who have less money, their expenditure increases, they have few healthcare options, and such issues are going to lessen the sources from which they can earn as well. So at this point of time, I hope you clearly understand that air pollution is not a separate problem. It is the problem of present, and it is involved in as many parts of life as you can understand. And I would like to add here that pollution anywhere is a threat to health everywhere. So this needs to be understood, and in order to address that, even in India we have seen multiple policy responses which I have quoted before also. If we talk across the globe, yes, there have been global efforts as well, but as I said, the difference lies in the policy and the implementation, because we are not getting to see the results. And which brings me to a very simple fact that clean air is not a privilege, it is a very basic human right, just as food is. Now let us understand that what can be the way forward in this situation, what needs to be done to address this situation. So as the consequences are coming from one dimension another, first, when we are talking about the environmental impact, we need to understand the impact. So there needs to be the investment in terms of understanding the pollution, real-time monitoring of the pollution. Then there needs to be investment not just in terms of technology, but also transition. Can you tell me in the comment section by which year India aims net zero target? Let me know in the comment section. Other than that, apart from that, there is global coordination which is very much needed, because if we are trying to address it in one place and not other, the problem remains the very same. At this point of time, there is an immense need of not just global unity, but green innovation and behavioral change at all the levels to actually reverse the worst of worst results that we have seen in this given report. Now let me know in the comment section what do you think about it. That was all from my side. Thank you so much.